In this video, today we'll learn about spider nevi. Spider nevi is also known as spider angiomas, vascular spider, or spider telangiectasis. So what is spider nevi? It is a telangiectasia that consists of a centrally dilated arteriole from which numerous small vessels radiate resembling the legs of a spider. So we have a central arteriole. From there numerous small blood vessels are appearing which appears like a spider. Telangiectasia meaning, it is a Greek word where telos meaning end, angion meaning it's a blood vessel, ectasis meaning stretching out. So when we tell a telangiectasia, it means there is a blood vessel which appears to be stretched. Nevi or nevus meaning is a mole or a birthmark. Okay, so you have a red color mark where it appears like a spider. Okay, so that is what is spider nevi. So you can see in this diagram here, there is a centrally dilated arteriole from which numerous blood vessels arise. And remember these small vessels, okay, they appear like a legs of a spider. And these small blood vessels, they receive blood from the central dilated arteriole. So you have a central dilated arteriole along with the numerous small blood vessels radiating from the central arteriole. So how do you examine or how do you confirm that a skin lesion which appears something like this is spider nevi? Okay, you take a small needle head. Okay, so press on the central arteriole using a needle head. So this is a needle, you can see the needle head here. With a needle head, just press on the central arteriole. What will happen? I told you the blood is actually moving from central arteriole to the smaller vessels. So when I block the central arteriole, the blood flow to these small vessels decreases and there will be a blanching appearance, meaning it will become pale. All these blood vessels surrounding the central arteriole will become blanch or pale in color now. On release of the pressure, again, what happens is the small blood vessels will start filling up from the central arteriole because this is the direction of blood flow. I'll repeat again. When I'm pressing on the central arteriole, all these blood vessels will become pale or it will get blanched. On removing the pressure from the central arteriole, once I remove the needle head, what will happen is all the small blood vessels will start filling up from central to periphery. So why do we get spider nevi? Remember, spider nevi are generally considered benign and asymptomatic vascular lesions. It may be linked to hormonal imbalance or sometimes it is considered as a sign of hepatocellular failure. So this is the appearance of spider nevi can be like benign or it can indicate a final stage of the hepatocyte failure. So when I tell hormonal imbalance, okay, that is especially during whenever there is a hyperestrogenemia or estrogen is increased, in that condition, like as happens during pregnancy, sometimes spider nevi is seen. When I told like hepatocellular failure, most commonly it is found in alcoholics. So where exactly you find the spider nevi? In the upper half of the thorax, that is above the nipple level and the back of the upper chest commonly. It can be seen in face, forearms and dorsum of the hands. So above the nipple level, in the face, in the neck and the upper part of the chest, both anteriorly and posteriorly, you can see the spider nevi. It is actually seen in most commonly seen in sun exposed areas. So as you can see here, the face, neck, the upper part of the chest, the forearm, all these are sun exposed areas. In these areas we can see the spider nevi. Why spider nevi are most commonly seen in the head and neck area? It is said that spider nevi are seen in the area drained by the superior vena cava. That is nothing but above the line joining both the nipples, above the nipple level, we can see the spider nevi. So usually they tell like it is the area drained by the superior vena cava. But why specifically only these areas? Okay, they are most commonly found in the sun exposed areas of the skin due to impact of the ultraviolet radiation because of UV radiation. Okay, prolonged and repeated exposure to UV radiation or sunlight will lead to damage to blood vessels and also the skin's connective tissue. Sometimes UV radiation can also cause dilation of blood vessels, not just damage to blood vessels. Sometimes the blood vessel itself simply can dilate, okay, dilation of small blood vessels. So, as I mentioned before, in the sun exposed areas, we can see this spider nevi, right? So why in sun exposed areas is because the sun, like repeated exposure to sunlight will lead to damage to the blood vessels and the connective tissue. At the same time, can lead to dilation of the small blood vessels. Now the question would be, why spider nevi in hepatocellular damage? I told you, right, in alcoholics this is most commonly seen. In liver damage, what happens is this can impair the liver's ability to metabolize certain substances. Okay, especially we call it as vasoactive substances. These substances gets accumulated. See here, liver damage can impair the liver's ability to metabolize certain substances, leading to an accumulation of all these vasoactive substances that causes vasodilation, and there's a formation of spider nevi. What are these vasoactive substances? Nitric oxide, prostaglandins, and bradykinin are the vasoactive substances. Normally, these vasoactive substances are metabolized by liver. Okay, now liver failure is there. So these hepatocytes are not able to clear nitric oxide, prostaglandins, and bradykinin. So what will happen is these vasodilator substances will start accumulating in the blood, leading to vasodilation, and that will cause formation of spider nevi in hepatocellular damage. So just to summarize, it is most commonly seen in the sun exposed areas of the skin, because sun exposed areas of the skin where the sunlight, no, the UV radiation can damage the blood vessels or sometimes can cause vasodilation. Now coming on to summary. So what is spider nevi? Spider nevi is it's a skin lesion where there is a central arteriole. There's a dilated central arteriole from which there are many numerous small arteries appear. Okay, they start from the central arteriole and it appears like a spider, right? This is the body of the spider. This all looks like the legs of the spider. So that is, and the blood flow is from central arteriole to the smaller arterioles. It is from central to periphery. And where exactly it is located? It is located above the nipple level, okay, in the sun exposed areas like head, upper part of the chest, face, and neck area. What is the cause for the spider nevi? There is vasodilation of the blood vessels due to increase in the vasoactive substances. This is the main reason why we get spider nevi in hepatocellular damage. Or sometimes a benign or asymptomatically, we can, in asymptomatic patients we can see this spider nevi, and that is the most probable cause would be because of damage to the skin by the UV radiation. And why are we reading the spider nevi? What is the clinical importance? See now, you see in any patient the spider nevi, okay, in these areas. Remember one thing: always rule out hepatocellular damage, because if it is benign or asymptomatic, it is okay. But rule out hepatocellular damage by mainly doing the LFT test. Okay, thank you.